Up next, let's talk about the lung anatomy. So here we have a picture of a cadaver with a pair of lungs in situ, and we're looking anteriorly onto the chest with the respiratory diaphragm in the bottom portion of the image, with little portions of the liver we can actually see as well. Now, before we kind of go through the differences between right and left, do we think that these are healthy lungs, normal lungs, smoker's lungs, really old lungs, cancerous lungs? What do we think? So if you said smoker's lungs, you're actually incorrect. These look like pretty healthy, regular lungs, but probably in a relatively older individual. So the lack of pink, fleshy, nice looking tissue is actually due, and the replacement of the gray and bluish tinge to it is actually due to just normal air pollution. So we're not really designed to, I shouldn't say we're designed to, but we haven't caught up with how long we're actually, like our DNA has not been able to catch up and evolve with how long we're living. Previously, we weren't really living past our 30s or 40s, and we also, air pollution wasn't a thing back then, and so we didn't even have to worry about air pollution. Now our lungs are constantly having to combat that in virtually every city in space, and because of that, in every human cadaver that you'll see that's a non-smoker, you'll see some level of this type of damage. Okay, moving into the anatomy. So the right side is going to have 3 lobes and the left side is going to have 2 lobes. The way I remember this is to draw an L. You just have to do 1 and then 2, versus the right is a little bit more complicated. Also, the left side is actually going to also contain the heart, and so that's why we need to have a little bit more room for the heart on the left side and not as much room for lobes. So whichever way, you need to remember that. The right side is also going to have 3 different types of named divisions for the 3 different lobes. 2 divisions for the 3 lobes, versus the left side is only going to have 1. Here's a cartoonistic depiction of the right lung and the left lung, just without the heart in the middle. So in the top portion, we're looking at the anterior aspect of it. I'm sorry, we're not looking at the anterior aspect of it. We're looking at it from the lateral side of the right and on the left, and that's one of the best views that you can actually see the individual separations between the different lobes. So on the right side, we have 3 separately named lobes called superior, middle, and inferior, versus the left, we just have superior and inferior. Both are going to have an oblique fissure that separates superior from inferior, except the right is also going to have a horizontal fissure, named because it goes in the horizontal plane or the transverse plane, that separates superior from middle. Other things that are important to know are the apex, which is the top pointy portion, so opposite from what we learned with the heart, and then the inferior border is going to be that flat respiratory diaphragmatic surface. So that's where the diaphragm is going to brush up right next to, so it's nice and flat. We also need to pay attention to where the heart sits in all of this, and the heart on the left side is going to be tucked away just next to that cardiac notch. So it's named cardiac because it's right next to the heart. Let's see what else is important to understand anatomically. Of course, everything else that's on your list, those are just the main ones that I'm thinking of right now. Similar to other organs that we have learned thus far, when we have a collection of tubes going in and out of one area, we call that a hilum. We were talking about the root of the lung. Now we're talking a little bit closer towards the lung itself, not as so a little bit more distal from the primary bronchus directly into the lung. That's where we're going to have the hilum, and the hilum will consist of the bronchi, arteries and veins and nerves coming in and out. Okay. Now we need to talk a little bit about the membranes that are surrounding the lungs themselves. So each lobe is going to receive its own supply of air and blood. And each lobe is going to be separated by those fissures, but the lungs themselves have to be separate from each other, the heart, and the thoracic cage. So how do we do that? And we'll do a nice picture here. So we can imagine the thoracic cage like this, right? With the ribs, and we can picture the lungs within the inside. Very simple cartoonistic depiction. And that's actually not really realistic because they're much bigger than that. So they come up pretty close next to the bones. Okay. And so now we need to separate out what is what. So just like we learned with the heart, we're going to have some membranes that are surrounding the lungs themselves. One is going to be very close, and that's what we call the visceral pleura. And one is going to be, let's see, what other, we'll do yellow. One is going to be farther away, the opposite one, so the other one is going to be the parietal pleura. And in between the two, we're going to have a serous fluid. So let's go ahead and draw this. So that visceral pleura is going to be directly adhered to that lung, as close as possible as I can draw. And honestly, you can't even see this with the naked eye, even on the cadavers. Then you have that visceral pleura, which is going to be attaching directly to the thoracic cage, directly to those ribs and muscles. Okay. And it'll kind of actually dip here, connect both halves. And then in between, we're going to have that serous fluid. So just a little bit, not a lot. There's not a lot of space to work with, but just to prevent friction and overheating. And we'll talk about why those membranes are important here in a second. So the blood supply towards the right and the left lung, we already know this from the cardiovascular unit, because we're receiving blood from the pulmonary circuit in order for it to be reoxygenated and distributed back to the heart. So we have the pulmonary arteries that are going to the heart and the pulmonary veins that are carrying oxygenated blood back to the heart. And we already talked about this in the alveoli video with that cartoonistic depiction, but we have a bronchial arteriole and a bronchial venule to each lobe, and capillary networks in between to provide blood to and from each alveolus. Then we have those alveolar capillaries that are where that diffusion of O2 and CO2 is occurring, and within the endothelium itself, that's where those cells are able to actually register differences in blood pressure, and depending on that, they will produce ACE, or angiotensin converting enzyme, which is a part of our RAS system, as we had learned previously. Okay. Let's talk about a disease state like a pulmonary embolism. Pulmonary embolisms can be very dangerous because if they're traveling through this small vascular highway, they're really easy, or they're more likely to get stuck. So remember, an embolus is a moving thrombus, and a thrombus is a blood clot. And these blood clots can be made at any time, at any point, for a variety of reasons. And if they become dislodged and start traveling, they'll eventually make their way back to the heart, which means that they can eventually make their way back into the lungs. And the capillary network within the lungs, it's much smaller than in the heart, so it's very easy for it to get stuck near an alveoli. And if that's the case, then a part of the lung can completely malfunction and not be used, and now all of a sudden you are not able to use that part of the lung, and bad news bears. So if this occurs frequently and over a long period of time, eventually one side of the heart might not even be able to work anymore, and this can lead to congestive heart failure. Okay, so back to those membranes that I was mentioning. So the visceral pleura is going to be the one that's directly adhered to the lungs, And that's really important to understand because that's going to be very different than the parietal pleura, which is directly adhered to the thoracic cage. The reason why this is important is because both of those membranes are going to interact directly with the tissues of the lungs themselves in order to help expand and collapse the lungs with every inhalation and exhalation. So during every breath in, right, the thorax expands and a lot of space is provided for the lungs to bring in as much air as possible and increase the volume within the lungs. But the lung tissue itself is very fragile. It's very limp. It doesn't really move on its own. There's no muscle surrounding it. So how is it able to open itself up like that every single time? So that's going to be with the help of a lot of musculature, which we'll learn, but partly also because the parietal pleura is in place. The parietal pleura will help physically open the lungs during every inhalation because it's directly attached to the thoracic cage. And as the muscles help open the thoracic cage, then so do the lungs themselves. If that doesn't make sense, rewind and play that a couple times. It's really important to understand. In order to help with compliance and in order to help open up the lungs every time we take a breath in, not only are we activating the muscles in order to open the thoracic cage and move the cage, but while we do that, we also pull apart I'm sorry, we shouldn't say pull apart, but pull open the cage, and directly attached to that is the parietal pleura, which is going to help physically open the lungs. See you in the next one.